connecting to cloud server, and now we are live. So I've advised everyone to pick their noses before the video started. No one did. We're live anyway. Welcome to this afternoon's Screenside Chat with CWD. I am really excited to be joined by three people from around the world to be talking about why language matters and how language can help either diminish or perpetuate stigma in diabetes management. My name is Kerri Sparling. I'm the CWD editorial director and happy to be your host this afternoon. And I don't know what order everyone is around me, but we have Sana Ajmal, I believe to this way. Down here I see Renza Scibillia right below me, and the grumpy pumper himself, Chris Aldred, joining us to talk about language matters. And just in the terms of being expeditious with time and that sort of thing, I was hoping that you guys could introduce yourselves so that way you make sure you're saying what you want to say and not the long, boring bio I may end up reading if you don't say anything. So Sana, can we start with you?
Sure. Hi, everyone. I'm Sana. Right now, it's midnight in my country, Pakistan. So please don't mind if I look sleepy or I act sleepy during this chat. I've had diabetes since 1998. Pakistan knows me as Dr. Sana. And here I've picked up the first card around diabetes language. This name gives me the right tool I need for the right influence while working in the healthcare in our country. I work as the executive director for Meethi Zindagi, which is a people's association, the only national organization looking after the interests of the community with the support of the community in Pakistan. I can never be as chatty as Renza and Grumps here, as I need to wear that doctor's mask, which I got hold of with a PhD degree, mind you, in engineering. I'll try my best to be more me and less Dr. Sana in this first hour on a Monday morning. Thank you so much.
And how about you, Renz?
Hi, everybody. I'm Renza Scibillia, and I am here from Melbourne, Australia, where it's 5 a.m. So I've still got my morning voice. Oh, my goodness. I'm absolutely thrilled to be here speaking about one of my favourite topics ever, language matters. I've had type 1 diabetes since 1998 as well, Sana. Wow, that was a good year. And I have spent a lot of time speaking and writing about why language is so important. So I'm thrilled that we're here. Thank you so much for inviting me to have a chat about it today, Kerri.
That is awesome. And I like that 1998 is referred to as a good year for diabetes, like it's a fine wine. Yeah. So, right? And how about you? I would say Chris, but that feels foreign from me. So Grumpy, can you introduce yourself and let people know why you won't be called Chris today?
Yeah, hi. Yeah, my real name that my mother gave me is Chris, or Christopher when I'm in real trouble. Everyone on the call, and a lot of people know me as Grumps just because of my online persona as the Grumpy Pumper. I was obviously diagnosed in a bad year of 1994, so I've never had type 1 for 26 years, although I must admit last year was an even worse year for diabetes because my son got diagnosed as well, my younger son. Yeah, it's great to be here and talk about language and why language matters. I've done, in the last couple of years, I think quite a few talks, a lot of them with Renza, because I had some fairly bad foot issues, diabetes-related complications, and the language, I suddenly realised whilst we were making progress within the kind of the diabetes world on language, it hadn't got as far as clinicians and people when it talked about complications, and the stigma around complications were just being perpetuated by the language. Mm-hmm. So yeah, it's great to be at home here in the UK. It's dark, but it's 8 p.m. So I actually have no excuse for looking or sounding like this. So sorry.
And well, and also just to add that I've had type 1 since 1986, also a good year. And in next week at some point, I think I'm marking 34 years with type 1, which is wild. But just to kick things off officially, so people tuning in for Language Matters, I think they have an expectation that we're going to be talking about things like, should someone call themselves a diabetic, or what sort of words can make someone feel bad or good or positive or negative about their diabetes. But could somebody just grab the mic quickly and explain what the Language Matters movement means in terms of diabetes care?
Oh, can I jump in?
Go for
Please.
It.
Let me jump in just to say that because I just want to pick up specifically on one thing you said there. Oh. People with diabetes, we can call ourselves whatever we want. So the Language Matters movement was not ever, and it has never been about tone policing people with diabetes. So you will never hear me say to another person with diabetes, don't say diabetic. I don't use that word for myself or in my work. I work for a diabetes organisation. But Kerri, you can call yourself whatever. I, was explaining this one day. I said, we can call ourselves Blossom for all I care. That was a stupid thing to say because suddenly people were calling me Blossom, but knock yourselves out. But it's not about saying to people with diabetes, you must use these words. It's about everyone else speaking about diabetes in a way that doesn't judge, doesn't stigmatize us, doesn't make us feel blamed. Because that's been the language of diabetes. It's one of the reasons that diabetes has such a shocking image problem is because it's been absolutely okay to talk about diabetes as something that people bring on themselves. And we can talk type 1, we can talk type 2, all diabetes is stigmatized. And then when we talk about complications, that sort of flows onto there. Well, you brought that on yourself. You didn't look after yourself enough. And I don't know any other health condition that has this way of speaking about people who are living with it. It's like we're being shamed for having diabetes and for all the stuff that then happens. So language matters is about a lot more though than the diabetic person with diabetes thing. That's really just scratching the surface.
Thank you for jumping right in hard on that. But that's because I think it's good to open strong and then also explain a little bit of what it isn't, because a lot of people make assumptions about what it is. And so Sana or Grumpy, do you have anything you'd want to add to that?
I would say, I'll just add on a personal story to this. I remember the first time when I attended the Young Leaders in Diabetes program by IDF back in 2011. And when these words fell into my ear, I believe it was Paul Madden or Phil Sutherland who said those words, we're people with diabetes. I felt suddenly so incredibly positive about my life with this condition. Before this, there was this unaddressed feeling inside me that even if I'm the best at everything, I'm still a patient, as if I'm a lesser being. That sudden transition from a patient to a person by a simple phrase was so incredibly empowering. Those words have stuck with me since then, and I believe that words can make such a huge difference in someone's life. And that is why it's very, very, very important to have the right conversations with us about our lives with diabetes and about us, so which can empower us with our daily management instead of judging us for our choices, which at times can be so very natural and they need to be understood.
How about you, Grumps?
Yeah, for me, as Renza said, that feeling of failure that we all have at some time is the thing where language really comes in. And again, for the complications thing, the thing that someone asked me when I told them about my foot, do you think you should look after yourself better? And that's what we get all the time, from a complications thing. And I'm afraid I probably talk about that way too much. But complications, you get diagnosed with diabetes, it doesn't matter what type, and you live your life with it. And if you get diagnosed with a complication, then you're seen to have failed in what you do. And we work hard, all of us, who again, regardless of type, every day just to keep going and keep trying to manage this. So language is massively important because you can feel really good about what you're doing, regardless of how things are and what you've got. And it's easy for someone to come to accidentally. The language thing is not a deliberate thing. I've never had anyone deliberately use language that made me feel bad. But I need a heck of a lot of motivation to keep managing my diabetes, managing my foot issue, which is healed, but on a daily basis, every step I take, because of various factors I won't bore you with, every single step I take every single day from now on until I die, I risk another foot ulcer, my third. And even if I'm cured of diabetes today on this call because it's such a good call, then I still have to live with the complications. So I don't want to be felt that I failed, because if I'm made to feel less motivated, then I've actually got a harder job in managing this. So that is the real driver for me. But I don't want to say that language isn't, like Renza said, it's not tone policing, it's not telling people off. And I don't know of anyone that's deliberately uses the wrong language. It's just helping encourage healthcare professionals, anyone to try and use the right language, because we see it now with COVID. There's the stigma around diabetes and obesity and things like that is being made worse by the pandemic, the fact that we are more at risk, and then the language and the way that is actually being told in the media. So I think it's an ongoing topic, and things like COVID and the pandemic really do kind of force it home.
Yeah, and I'm glad to hear you bring up the pandemic, because that often becomes, in discussions like these, the elephant in the Zoom, because nobody mentions it. And even though it is like an overarching and underlying factor to so much of what we're talking about, and can make things like media sensationalism and that sort of stuff, you can become hypersensitive to it because there's not a whole lot else to do sometimes other than just absorb the news. But you've given a couple kind of examples of words, situations where words have been a problem. Can you be specific about what kind of words those are? Because then I want to jump from there to what language could have been used, should have been used, and how you lead people down that path. It's kind of a big question.
Well, my one is, I refer to it as the C word, and that's compliant. Non-compliant, compliant. Those words have absolutely no place in diabetes care. And I quite love it when the Language Matters movement sort of was picking up. People are understanding it like, right, must not use compliant or use adherent. It's like, it means the same thing. And this is part of what I guess the whole Language Matters movement has been about. It's not just about picking out one word, throwing it out and picking up another one. It's about changing attitudes, and it's changing behaviors, and it's changing what's behind those words. So the idea that people with diabetes are naughty and need to be told off when we are not following instructions, and often they're instructions that we weren't actually part of, we weren't part of the development of that. Being told we're not meeting measures that we didn't create. We didn't create an HbA1c. We didn't decide that that's the great measure of how we're going with our diabetes. For us, or for me, a good measure of my diabetes is that diabetes is not absolutely everywhere and bearing down on me. It's that I'm sleeping well. It's that I am able to manage my diabetes. So that, for me, the compliant and non-compliant and adherent and non-adherent words are particularly sweary.
And how about you, Sana? I like particularly sweary.
I think there's a lot around this. And now that I work with the diabetes community, there are stories every day, and I can share a few of them. So, for example, like just yesterday, there's this mother who came in with her son being diagnosed with type 1 and landed in a DK condition, discharged, and now this child has been told to inject at 6 a.m. and then at 12 noon and 6 p.m. So these are the timings that have been set for him. And this child is because there are no schools these days, the children generally waking up later and sleeping later as well. The child is incredibly stressed out about this. And the mother called me up and asked me, Sana, can you tell me if it's like you wake up every morning at 6 and do the same? And I'm like, of course not. I mean, that's Renza, it's your injection time after an hour. Only today. Okay. So like all of these things, now this child and family was not made a part of the decision given to them about the management routine that the child has to follow. Now, what will happen when this child goes back to the healthcare team and tells them that the levels are all over the place because the child was not ready to wake up at that time in the morning and have that breakfast? That child would be labeled as non-compliant, as just Renza mentioned that. So that's I think that needs to be readdressed and rethought. First part is that. The second part is like something that I very deeply believe is the divide that came in between the type 1 and the type 2 community was because of the stigma that was associated with the type 2 community because of the prevention campaigns language. We really need to see also about the prevention campaigns that carried that certain stigma associated with having diabetes, which then created type 1s as like, oh, no, we're not one of them. So we are one community, but that it was that stigma, that language that created this divide between the two communities. And I think with this Language Matters campaign, with its better understanding, the two communities should be able to reunite, be more inclusive, be more understanding towards each other.
Well, thank you for sharing that. I agree with both sides, both items that you've listed. Of course, Grumpy, did you or your beard want to chime in, or?
Yeah, the beard can talk. Yeah, both of those. So compliance is a big one because I've been called non-compliant I even got called non-compliant in my footwear when I was having foot treatment, because I had a really, when I first got it, I was very excited. I had a really nice boot that was going to help me get my foot better. But after 2 years of wearing it and being on my third, because I'd actually worn 2 of them out, it gets a bit, on a hot day, it's really kind of sweaty and horrible. On a cold day, your toes go blue because it's really cold, however many socks you wear. But there were times when I just went out wearing a suit and I wanted to wear matching shoes. And ones are actually level, because the boot was a big thing and it was screwing my back up. So, but did you wear your boot every day? Well, actually, no, I went out and I wore a suit. Oh, well, you need to be compliant in your footwear. I mean, it's not that I didn't want to, again, that suggestion that I didn't want my foot to get better. It's just that mentally, and it probably sounds ridiculous, but mentally, I just needed to feel normal and feel that I didn't have a foot issue, and not have some really nice people say, "Oh, what happened to your foot?" Because I'm just sick of that story. It used to be, "Oh, were you skiing or playing football?" And I'd explain, "Well, I've got diabetes," and straight away most people go, "Oh, okay." It's like, football or skiing? Yeah, skiing. I'll just alternate. Because that's diabetes, as we all know, and complications are not just physical; they're psychological as well. But the biggest one for me is, as Sana mentioned, prevention. I don't like the word prevention when we talk about complications, and I don't like it when we talk about diabetes, because all you can do is reduce the risk of complications.
And that's what I was going to ask. Like, if there are words and phrases and just ideologies that just grate against you and are not productive, what's the opposite side of that? What is a productive discussion around complications? What does that sound like? What does that look like? And then another part of that, not to add on, would be patients talking about it in a certain way is one achievement, but how do we get clinicians and caregivers and people outside of those living with diabetes to kind of glom on and join us on this journey towards talking about it in a way that feels right?
Yeah, for me, I mean, I'd like to replace, when you're talking about complications and diabetes prevention, I'd like to just change it to risk reduction. Because the analogy I always use is, one, sadly, we are more at risk of stroke. We don't like to talk about it, but we need to. So everyone that gets born and isn't dead yet is at risk of a stroke. It's that simple. It sounds ridiculous, but it's that simple. As you get older, your risk of a stroke increases. And the only way to do that is to not be alive, which again is counterproductive, really. You get diagnosed with diabetes, any type, your risk goes up, and it goes up by pretty significantly. And then I've got all those things. I got born. I'm not dead yet. I'm getting older. And then a couple of years ago, my dad had a stroke, and he recovered. My grandfather died of a stroke. So within that line of adult males, we're now showing a pattern of stroke. So my risk goes up, and I can't do anything about that. So I could live my life and have a stroke because of diabetes, and that would be put down, tick the box, you died because of this. Actually, if I didn't have diabetes, potentially, my family history shows I might have had it anyway. And when we see people, they do absolutely everything they can, and that's, they work really hard and keep in range. We do know people who haven't had diabetes for very long and do get complications because they just have that genetic predisposition to get them. And again, it's that failure. If you talk about prevention and you get it, then you feel like you've failed. The same with diabetes prevention programs. Firstly, that gets people with type 1 fully understandably going, you can't prevent type 1, because that's a fact. But that adds stigma then to me. If you don't finish that conversation, it adds stigma to people with type 2, because it's not our fault, but so you need to finish that conversation. But you can just imagine, and if you put yourself in a position where you're told you're pre-diabetic or whatever the phrase is, and you're given put on this prevention program, and you do everything you can, absolutely everything, you work really hard, but you still get type 2 diabetes, because actually not everyone's going to, or actually later on you get it. You didn't prevent it, so you failed. There's that kind of insinuation that from the word to me, if you do this to prevent it, but you still get it, you failed. Well, actually, that prevention technique or the things you're doing is actually just risk reduction. So sorry, I'm running out. You can tell I'm quite passionate about this. I think it's really important because, living with type 2 diabetes is hard. I can't imagine what it's like. I haven't lived it. I've talked to people, but it's diabetes. It's hard. if you do a prevention program, but you still get it, you've got that feeling of failure before you've even started on your life with diabetes. That's not a great starting point.
I think we've needed to get smarter and more nuanced about the way we talk about diabetes in general. And, you know, I work for a diabetes organisation. I work for the diabetes organisation that put out a language position statement. It's 9 years this month that we wrote that. It was the first language position statement around diabetes. It started the conversation, and I have to be, I'm very clear about this. It started the conversation amongst health professionals and diabetes organisations, but it's not like diabetes said, this is a thing. This was done in response to the diabetes community. I remember one of the first things that I, you know, read about when I was diagnosed was, you know, I was on a chat forum. We used to have forums in the olden days, and this was the conversation that we were having. We were having these conversations, and I can only imagine, and I know they were happening long before I was diagnosed with diabetes. But Diabetes Australia said, we need to do something where there is a position about this, and we need a bit of research behind it. So we had that. We had the rationales behind why not to use this word, why language matters, what the impacts of it, how negative it can be. But prevention always, I think, remained one of those things that was really difficult, because we, you know, it was new. We were using it a lot. We were throwing it around everywhere. Diabetes organisations were using it. I went back and looked at some of our campaigns, and they're horrible. And I feel that they absolutely contributed to a lot of this stigma. But we've had to get a lot more nuanced. So now when I've got a camera in front of me because I'm speaking as a spokesperson for my organisation, or the CEO is, we talk about modifiable and non-modifiable risk factors. There are things you cannot do. You can't change your age. You can't change your family history. You can't change your genetic background. All of those sorts of things, you know, you absolutely can't change. But we still need to be very sensitive when we're talking about the things that you can change. You know, there's so many assumptions and there's so much privilege when we talk about lifestyle changes, as if we can just, you know, click our fingers and make those changes. It's not like that. The challenge is, when you're standing up and talking about it, is how to do it in a sound bite, because the news camera in front of you, when that gets into the cutting room floor, they want a 30-second sound bite around that. So that's one of the real challenges, is how do we have these conversations? How do we change these conversations and reframe them in a way that it just starts to roll off the tongue of everybody, not just the people who are thinking about exactly the words to use that don't stigmatize. It's tough. It's not easy. It's really tough.
And do you think that that kind of plays into people's assumptions, wrongly so, that this is about tone policing and this is about making sure that we're substituting the right words, that this is more about the mindset around how we talk about diabetes, not the specific nouns and verbs that we're plugging in?
Yeah, I think it is a little bit. I think that, well, I think part of the issue around tone policing is that people with diabetes are, you know, it's great because health professionals have picked up on this and they're like, oh, okay, well, I've read the position statement. It says don't use this word. And so they start correcting people with diabetes. They miss the bit in the position statement that says this is not about tone policing people with diabetes. Maybe we weren't clear enough in that first one that we put out. We're about to launch a second position statement at Diabetes Australia around that, where we've made this a very, very clear point in the statement. But I think that is part of it. You know, people are sort of picking up, oh, okay, this is the stuff we should say, this is the stuff we shouldn't say. But then they're yelling at people with diabetes when we dare to say the wrong thing, or they're turning around what language matters means and you know, to fit their own narrative. And that, I think, is actually also quite problematic.
Yeah, it absolutely sounds like it. And it also sounds like, as a human nature sort of quality, if a conversation is going down the wrong path, it's okay to sort of check your awkwardness and say, wait a minute, this got off to the wrong foot, sort of thing. How can I do this better? How can we learn together, instead of planting your flag and say, well, let me just continue on this path of saying it in the way that's super awkward. It's like, no, embrace the awkward and make it more of a discussion where we can learn from one another. And I also like the idea of putting out a second position statement, because things change in our community and our language evolves in terms of what we accept to hear and what helps us to hear and what's beneficial for the community and the clinicians alike. So I like that there's a revamped sort of thing, because this is a growing, changing, dynamic sort of movement. Yep. And Sana, I saw you nodding over in the other corner of my screen. So did you have something you wanted to say?
I just wanted to add on to this is, for example, like there's this, I think quite a few of us know Professor Phyllis DeRose. She's a person living with type 2 diabetes, a diabetes advocate herself. I was having a conversation about this with her, and she said, see, me and my sister, we are almost the same age. We lived in the same household. We had the same lifestyle. Everything was similar. Our genes, well, more or less, because we are from the same parents, have similar makeups. Of course, they're not exactly the same, but I got diabetes at a young age while she did not. So when we attach this notion to prevention around diabetes, that it happened because of this factor, or it happened because of a bad lifestyle, or it happened because of the age, I think that's the very thing that causes that stigma that comes to people with diabetes overall, even if they're like type 1, because again, the same debate that we are often judged and stigmatized because people think that we have the same kind of diabetes that we have caused to ourselves. Nobody wants to cause diabetes to themselves. Nobody wants to cause diabetes to themselves, and nobody wants to cause a complication to themselves. We all try our best, and it's not always easy. It's not always easy to succeed 100% in everything that we are doing with this condition. So yes, it's like it is not about tone policing. The difference lies in understanding that the tones we are used to using are not appropriate, and maybe based on biases that we have learned from partially incorrect information. And in understanding that nobody wants to cause diabetes to themselves, that diabetes is a very tough life partner, and everyone can do their best to manage it if they are given the right resources and the right conversations empower them to do so.
I love the idea of diabetes as a life partner. I mean, I love it. I reject it because I don't want it, but I really like that ideology. You have to learn to live
you weren't
well.
given a choice.
Yeah, that's right. They moved in and they won't move out. We talked about, sorry, I do have a couple of notes from earlier, and when we were talking about questions that we wanted to make sure that we had covered. And so talking about the way that people talk about diabetes and complications, that can be very difficult. So what are some ways that people with diabetes can implement language changes in their clinical encounters, specifically when they're sitting with their doctor or their nurse? What can they do to help make that conversation shift it so that it hits the right mark, the right tone, the right feeling?
You don't have to. I think that's the point that we have to start from, because not everybody feels comfortable doing that. Now, you bet I will say something. You know, I'm pretty bullshit about it. I don't like that word. That makes me feel uncomfortable. Use this word instead. I say and do that all the time. I feel judged when you use that language around me. But not everybody wants to do that. And I think we need to be really aware that not everybody can be having these conversations, which is why we need to have the system, this systemic change where it's actually just happening. You can't expect somebody who's newly diagnosed with diabetes who's suddenly feeling really overwhelmed and also a bit judged at the words that are being said to them to say, hang on a minute, we're now going to analyze the language you're using. That's
yeah, it's a pile-on. Yeah.
But one of the great things is that it's not just Diabetes Australia that has a language position statement that you can put in front of healthcare professionals. And I think that that's one of the great things, is that it's not just us seen to be ranting and raving and talking about political correctness. We can point to evidence. There is evidence now. So if you're feeling that you're able to do this and that you're robust enough and you want to have the conversation, you can actually speak with your healthcare professionals or send them a link to the Diabetes Australia position statement or the ADE, which is not called that anymore, position statement, or the Diabetes UK position statement, or any of the ones around the world. There are now, there are heaps of them. Diabetes Canada launched one just 2 months ago. So that's often a really good starting point, is, hey, have you seen this work that's been done? Because actually there are some ways that perhaps might make what you're saying more receptive to people living with diabetes.
And I love that, though, because that empowers the person who may be feeling stigmatized to not have to go through the whole discussion and the sit down and this is how I feel, but more, can you just read this? Here's a link. And just by the clinician or that healthcare provider receiving that link, it just flags for them that that there's work to be done in that discussion. I love that. That is amazing to have a resource for people who might not have the words yet for what they're looking for the words for. So thank you guys for being trailblazers in terms of getting that out 9 years ago and helping people create that for their own organizations too. That's amazing.
Yeah, I am so proud that we have that we created that, but I am more proud that it came from the community. You know, it wasn't something that we just, as I said, made up. It was in response to the conversations that we saw happening, you know, with people with diabetes, and we wanted to represent that. We wanted to help to give them that tool to hand on to anybody who was, you know, perhaps needing a little bit of a push or a nudge in the right direction.
Well, talking about pushes and nudges, so we have a question from the chat. There are two questions. The first question is about language matters, and it is this an issue for people living with other health conditions? Do any of you have any perspective on it? Is it just people with diabetes, or is this stepping outside of this particular chronic illness, the language around talking about the disease?
No, it definitely is with other illnesses. So I know that Obesity UK, and I think probably the obesity charities in Canada as well, I'm not sure, but they brought out a language position statement as well, because of the stigma around, you know, obesity, all the assumptions, all the talk about lifestyle. But actually, one thing, you know, Sana said, and again, it's that we talked about it for years, but actually lifestyle, you know, we need to recognize actually lifestyle is very different for different people, different socioeconomic backgrounds. With diabetes, again, Sana said, you know, we need the tools and resources. Not everyone gets that, depending on what country you live and depending on what type you have. You know, people with type 2 in the UK on insulin will get a blood glucose meter, but if you're not on, you don't. You'd have to buy it. So, you know, but yeah, other illnesses, other conditions, definitely. And I mentioned it because I know specifically of obesity. I don't know about other ones, to be honest. I think some conditions have less stigma around them. But yeah, definitely the ones that, you know, the ones you can pick where there's stigma, things like obesity or being overweight, diabetes, there's just stigma around it everywhere. So they're the ones that really need and seem to be getting the language position statements now.
I mean, we know that there is stigma around mental health. We know that some cancers have more stigma than other cancers. You know, we think about lung cancer, people are blamed because they often were smokers, even though obviously not everybody with lung cancer was a smoker. And even if they were, pretty sure that not, you know, as they were lighting up, they weren't thinking, God, I hope this gives me cancer today. But there are, so other health conditions also do have guidance on the way to speak about them. So, you know, and a lot of it does come back to that person first language. But what we're also seeing is that in certain communities, there is a real push to not necessarily use that person first language. So if you have a look, for example, in the disability community, there is a very big discussion around, no, I want to be called disabled. I don't want to be called a person with a disability. This is part of who I am. I don't want to hide behind it. The same with the autism community. Please call me autistic. That's the language that I want to use. And I think that this is what it has to come back to. We have to be listening to the people who are living with this. This isn't about an organisation saying these are the words you must use. It's not about health professionals saying these are the words you must use, or the media. It's about those of us who are living with it. We own our condition and we own the way that we speak about it. And so I think that whilst it is across different conditions, it's not like a universal thing. You can't say, right, okay, so diabetes organisations are saying when you're talking about diabetes more generally, you should say person with diabetes, even though some people are quite happy to be called a diabetic, that this is a word that we use, because that's not necessarily the case. Do the reading, go to the organisations, talk to the people. That's the important bit, talk to the people.
And let me just add really quickly, for those who are listening who don't know exactly what person first language is, can you just do a quick primer on what that is?
Yeah, sure. Well, that, I guess, you know, specifically, and I hate to sort of focus on this bit about it, because it's so much more than the person with diabetes versus diabetic. I just really cannot stress enough that language discussions may start with that, because it's often the entry point, but please don't think that that's it, because when we do, that is why people think it's just about political correctness.
Right.
And it's not. And this is the thing that I've spent so much time trying to explain, is that the trickle down effect is so significant. It means that people out in the community, when there's a fundraiser, diabetes will be the last cause they put their hands in their pocket to, because we are seen as not deserving of their money. We know that when it comes to government research bodies, they give less money to diabetes. We see that year in and year out. Less money goes to diabetes than other health conditions, because It's a lifestyle condition. Get off the couch, walk a bit more, you'll be fine. And that's not the case either. So this is why it's really, really important. We have to have the community understand that diabetes is just as serious and just as worthy of their attention and their money as any other condition is.
Thank you.
Sorry.
Seriously, no, thank you. I know you were like, you know, catch me if I'm going. We like when you go though. I like where you're going with this. So thank you for that.
Sweet.
And then the other part of Sana, do you have something you wanted to add?
Yeah, just
Please.
talking about political correctness.
Yes.
So one thing, this diabetes language matters campaign, or for any health condition, the language matter campaigns is much, much more than just political correctness for one part. But on the other part, what's wrong with being politically correct?
Yes.
I mean, it's a language that is intended to ensure that your words, your sentences would not affect people who are vulnerable to discrimination or stigma. So what's wrong with using that? Why not just adopt that as a society, as a community on the whole? That would do everyone a lot of good, people with diabetes and healthcare professionals, as well as the whole society, because recognizing a person in charge of his or her life with diabetes is the very thing that would empower them to lead good lives, and that would improve health outcomes. So why not just start there?
I'm for that too. And that actually feeds into the second part of the chat question here, which was, oh, Grumpy, did you want, before I jump into the second part, did you want to add something?
So I think for me, the least person-centered language is when I've experienced within talking about complications, when your podiatrist talking about your diabetic foot. They actually reduce you to a single body part rather than yourself. And I've explained a great relationship with my podiatrist, because obviously I've known him now for about 50 years, the way this has been going. But it's treat the person, not the body part. That's what I always say, because I've got to live with it, and it's not just a hole in my foot. It actually affects everything I do. Like I said, walking, my back hurts, various things, but also up here, mental health. I didn't get any burnout. I didn't feel, luckily, any burnout of my diabetes for 25 years, 24 years, until I had that issue with my foot. And I got burnout from, everything to do with it, just having to live with that, have IV antibiotics, everything like that. So I think, you kind of just, that's the least person-centered language I've ever heard, and I would prefer it to be changed.
Well, in working towards that kind of change, again, the second part of this question really feeds into that. And that is, has anyone worked to bring a class on this topic to medical students? So how do we, as a community of people living with diabetes who want to see this change implemented, how do we get in at the ground floor of where clinicians are coming in to interact with patients? Have you done that?
Yeah, I do. Every year I speak to, and I always feel so bad. It's literally in their first week of being a med student at one of the universities in Melbourne. I think, gosh, I actually, the way that I introduce it is I say, I'm your nightmare patient, but don't call me patient. And
is that the talk title name?
Start off on that. And I guess at that stage, they probably don't even know what they're talking about. So I think that one of the real struggles that we have is it's great to get in at that level, but it's actually probably a conversation we need to be having each year. Where there is some really great stuff though is, I know that in Australia a couple of years ago, my endocrinologist actually led the development of a book that was specifically for endocrinology trainees, and it was specifically around communication. And I was, involved in a couple of different stages of that, I guess, as a lived experience representative or patient rep, consumer, whatever words we want to use. And I love it because what they've done is they've highlighted words and phrases and behaviors that can be problematic, and then provided solutions, instead of this, say this, or ask this instead of this. And that was just, I just loved so much that specifically for people who are going into deal with, and this one was specifically around type 1 diabetes as well. So there was some really very nuanced work in there. And I just think that that's terrific, just to know that that's part of the training. And I'm thrilled that, the endocrinologist who led that is actually my endo. And in 19, I can honestly say she hasn't uttered a word or a sentence that has made me feel in any way judged or shamed. And I think that that's a pretty remarkable thing to be able to say about somebody who I've been seeing for so long through some pretty crappy, but lousy times, I might add as well, you know, times where another health professional may have thrown that C word around at me, and you know, she's never ever done that.
And how about, and so you were able to speak with those med students as well on that ground floor sort of thing. So do you, and for the group too, do you think it's important for medical students to be hearing from patient voices to put disease in context?
Yes, absolutely.
I think it's incredibly important. And for example, for me as a diabetes advocate, whenever there's a language issue that comes up in any conversation, whether I'm at a conference or meeting anyone, any group of people, they may be health professionals, they may be people with diabetes, they may be general public. And if I hear these words that are problematic to me or to the community, I take that very opportunity as a chance to advocate for language matters. So that's how I take it. But I also see that a lot of organizations around the world are taking up their position statements, publishing their guidelines, also educating health professionals, working with those organizations to adopt the right language around diabetes, which is very, very encouraging. So recently in Pakistan, I've heard another healthcare association has adopted diabetes language guidelines with the help of NHS, which is very encouraging. I'm really, really looking forward to see the action around that guidelines and that really being absorbed and acted upon by the community as a whole.
And how about for you, Grumps?
Yeah, I've not been involved in anything like that specifically, but yeah, I've seen some great changes in diabetes conferences, and the titles of the talks and the content of that, and I know language position statements go out, I think, at all conferences now to speakers before they actually write their talks. I think it's really, very important because, yeah, if people are talked to in the way that you want them, using the language you want, then if it's done enough, this is what they hear, they start to copy it and use it anyway. I think the biggest challenge is that and it's not just, you know, student healthcare professionals, it's everyone, the stigma around diabetes is there before you know about it. You know, I'll admit it, and I'm ashamed of it, but it was no different before I had diabetes. I had all of those assumptions, all of that stigma. I didn't, you know, the difference between type 1, type 2. I would have said all the things that stigmatizing things that I now cringe at and hate and try and correct people because I wasn't exposed to it. So, you know, and I know Renza wrote a good blog post on it, and we've used it in talks as well. We were at a conference, I think ADA, where a slide went up and it was statements from someone, and the question was who said these things, and there were all things around how people with type 2 need to get up, and, you know, they need to change their lifestyle. They brought it upon themselves. I'm fed up with my diabetes patients because of this and this. And it was, you know, we were thinking, oh, is this some, you know, established endocrinologists who have been doing this for 20, 30 years? It was actually student nurses, I think. Renza can tell this story way better than me. But and again, that's not criticism, but that's how they come into the job when they want to help people. You know, they want to help people. So it's trying to get rid of the stigma that is just out there, that they've learned and that they've seen via the media and via everything else. Just how do we get rid of that? And it's got to be a big challenge.
And but you've also just cited the fact that you once thought and said one thing, and now you think and say different things. So change is possible, and people over the course of long amounts of time or short amounts of time can make that change if they're properly educated.
Yeah, and open to it. I think that's the thing. You know, and it comes down to the way that we frame this. So the fact that, you know, conferences now are often speakers are sent to position statement. Please, you know, align what you're saying in your slides with the language here. There's still a long way to go with that. I know that a lot of conferences do that, but I still sit in conferences all around the world and get very twitchy because I see the words that are being used and the assumptions that are behind them.
Yep.
You know, it's really, you know, there are some things that are really little. And I tweeted this out the other night just as a random thing that was going through my head. It was, you know, people living with diabetes when we're really struggling, we're often called difficult patients. I mean, I don't know who on this call has been called a difficult patient at some time. right? Or challenging. And I flip that and I say, it's the diabetes that's difficult. It's the diabetes that's challenging. I'm challenged by diabetes. I find it difficult, and I'm living with it. But it's those sort of little mindset changes that I think are really, really important. But it's also important to keep on track and focused about why this is an important issue. And I think that sometimes it gets hijacked a little bit it's about manners and it's about politeness. It's really not. It's about far more than that, because that's when we start to be blamed as being politically correct. I totally agree with you, Sana. What is wrong with using language that makes people feel good? But people dismiss it if they think that. It's like, we're precious little flowers who can't deal with, with hard language. It's not about that. It's absolutely not about that. It's about recreating what has become a really quite toxic environment, the world around diabetes, the language that is used, the finger pointing, the fact that kids in the schoolyard feel taunted, the fact that adults have food ripped away from them as they're about to take a bite. All of that sort of stuff is because of the way we've spoken about diabetes. It's why we're so committed to, I am so committed to continuing to work through this.
And that's
totally off tangent. I have no idea where.
No, but I'm completely here for it, because actually one of the other questions I wanted to ask was, with so much progress that's been made, with position statements being put out by different organizations, with clinicians and patients alike adopting this sort of language and working towards this change, what is the end goal for a movement like this? Is there an end goal? Is it a moving target? Like what does the ideal adoption of this look like to you guys individually? Sana, can I start with you on that?
Yeah, okay. So I think when we talk about people-centered healthcare systems, and there's a lot of hype in the world, in the diabetes world, about people-centered healthcare systems and empowering people to take up leadership roles in their diabetes management. I think the very first thing that puts people in the right place in this people-centered healthcare system is recognizing them as people, is recognizing them as leaders, is recognizing them as the most important part of that healthcare team that has to manage their diabetes. Like all the other parts, if we talk about the family, the healthcare providers, the society, the friends, everyone is in an assistive role. The person with diabetes is in the leadership role in that system. So how do we go there? For me, this whole Language Matter campaign is to ensure that people with diabetes are recognized as the most important stakeholders in the diabetes world, not as patients, not as customers, but as leaders of their individual lives and leaders for the diabetes community. And that's where the language is important. If you are stigmatizing a leader, how do you expect them to take up that leadership role? If you are judging them for their choices, like, of course, they have made those choices. Of course, there are reasons behind those choices as well. But we have to make sure that we understand those choices and do not stigmatize these leaders, because I care about my diabetes more than anyone else in the world. And I'm not going to accept anyone pointing fingers or blaming me or shaming me for this. So that is where I come in the right way. So when I share the story about the first time I heard the person with diabetes and that the empowering effect that has, for me, this whole campaign leads to this person-centered healthcare systems, which is what I'm looking towards in the future.
Everyone is nodding as you are talking. I wasn't sure if Renza or Grumpy, do you have anything that you would add to that? The end goal?
Yeah, I think that is absolutely, I think patient-centered care is truly the end goal, but I think we are so far away from there. You know, I don't know a health centre that doesn't call themselves person-centered or patient-centered, but when you just scratch the surface, you realise that there's a lot of tokenism in there, and there's a lot of using the right words to make it sound that way. But I also think it's that, you know, I think we get there when you mention to somebody that you have diabetes, and the words that they say are not things like, oh, have you got the one that you brought on yourself? Have you got the serious one? Have you got the one that you got as a kid? All of those things that they're trying to categorize you into the one to decide whether or not you're worthy of having this conversation or worthy of their sympathy is not the right word. We don't want to be pitied. We don't want people to you know, but for us, you know, for them to think that you know, we're worthy of the healthcare that we need to, you know, that we need and all that sort of stuff. And I think that, you know, success for me will be measured when diabetes is considered up there and as important as those other conditions that are just as serious. You know, it's certainly about elevating where diabetes is, not bringing other conditions down to our level, if you like. You know, I want every health condition that is serious to be considered that way. And I think that we've got a long way to go, because we really need to get over that, you know, all the preconceived ideas that we have. But I think mostly for me, it's people walking out of healthcare appointments not feeling demoralized or just broken. It's people like us sitting there and watching a news program, a story about diabetes, and not wanting to throw a shoe at the TV because they've been so horribly stigmatizing and saying such, you know, or showing a person without a head just walking down the street but with a big backside, or, you know, eating a hamburger. You know, we need to humanize diabetes. That's the end goal, is that it's a humanized condition rather than something that's just so stigmatized.
For a brief moment, I just was picturing headless people walking around, and it was very unnerving. So I had to, you mean the zoomed in, right, then the body parts only, sorry. But yeah, what you had said about leaving a clinician appointment and not feeling demoralized, when I think about Language Matters and the success of that, it would be, you know, as I've had diabetes for a really long time, I hope to have it for even more of a really long time, because I want to keep going, but I know certain things are going to crop up. And as those new diagnoses come into play in my life, I want to feel empowered to handle them, and to handle them in a way that makes me feel like I am rooting and my clinicians are rooting with me for my success. And knowing that whatever diagnoses may come at me, feeling like there's a team that supports me and doesn't say, well, you did this and that's why you have that now. It's like, no, this is the new thing. Let's deal with it as a team. What's the best way we can approach it? That sounds ideal to me. And that's a very personal sort of thing. But Grumpy, what do you think?
Yeah. So I deliberately went last because I can just agree with everyone else. Yeah, basically everything that Sana and Renza just said. I think the other thing is, Renza said, you know, coming out of an appointment, actually, people not being scared to go into them.
Yeah.
Because that is huge, and is why I wrote my first blog post many years ago. Because, you know, people, I used to see people online saying so much. I'm sitting around an appointment, I'm dreading what they're going to say. I'm worried about this. I'm worried about that. Mm-hmm. Now, diabetes is a worry every day. We're always going to worry about something. We don't need to go into those appointments worrying and going scared, because the first thing, and I've done it, you know, for years, the first thing I wanted to do when I got into my appointment was get out. Mm-hmm. And that's not going to help me have the outcomes I need, one for my diabetes and two for my life and how I feel. So yeah. And the other thing is, on a real personal level, I think it's kind of reached endgame when I hear in the background diabetes mentioned on the news, and I just don't physically cringe, wondering what, and start almost shouting at the TV before they've even started talking, because you kind of know what they're going to say, and it's not going to be correct. And then on the few occasions you're actually pleasantly surprised when, you know, someone actually says something sensible and gets it right. That should be the norm, not the.
That's the anti-shoe throwing moment, right? Pretty much.
Yeah.
Yeah.
Do you think that there is a good reason to feel hopeful that this change is happening?
Yeah, we're having this conversation.
Yeah,
we're having it here, but you know, if you have a look at, for example, ADA programs in the last few years, language has been one of the things on that program. If you have a look at conferences in Australia, it's been on the program. You know, I've stood on the stage and spoken about this around the world because it's there. You know, organisations like Diatribe have language that they put out something years ago as well about, you know, language to use. You know, I think that we should feel hopeful because we're having these conversations, but it's not just us having these conversations. They are being had by others as well. But I would say, and I would really encourage, and I'm speaking and we're speaking with other people directly living or affected by diabetes right now. But I guess if there are any health professionals out there, if you're wanting to talk about this, but bring people with diabetes into that conversation. If you're standing up in front of a room full of health professionals and saying, this is why this is important. Please, please, please put people with diabetes or parents of kids with diabetes standing right next to you, because we can tell the stories about those examples that have really harmed us. They've really hurt us. And I think that that's really important for people to understand just why this is such a critical issue.
That's really good advice, making sure that the voices of the people living with diabetes get heard.
Always.
I think in the way that this is happening is, apart from what we're seeing at the conferences and everything, for example, I'll pick up the example of our peer support group in Pakistan, which was just formed 3 or 3.5 years back. People are beginning to speak up about this amongst themselves and in their families and in their schools and in their and amongst their friends, which is just great, because as long as we people with diabetes keep advocating for this, change will happen. I'm sure it will be slow, as Renza said, that the end goal is very far away, but yes, we're taking the steps towards that, and that's very much visible.
Well, I really appreciate all 3 of you taking the time and being patient with the fact that the sun is trying to slice my face in half as well. I'm sorry, I was trying to dance and avoid this sun sliver, but it just to be able to spend this hour with you guys and to talk through something that is so important and to know that it is a work in progress will hopefully inspire other people who are either watching or who catch this on the replay, that this is something that they want to be involved with and to help kind of implement change around. So thank you for being very generous with your time and with your words and getting up at weird hours or staying awake until weird hours to be part of this conversation. But is there anything before we go, because we have about 2 minutes left, is there anything that anyone would like to add? No pressure to add anything. But do you feel like we have served this?
Just keep talking about this. Keep talking about it. And you don't have to be the person who is out there, you know, having the conversations necessarily with your healthcare professional, but there are places that you can go to help facilitate that conversation. You know, send a sneaky little email after a difficult appointment and those sorts of things. Don't feel you have to do everything, but there are places and people who will help you. Reach out.
The diabetes community has the back of the diabetes community. That's been consistent in the last 15 years that I've been a part of it. So it seems like that'll keep moving forward. But Sana, Grumpy, you guys are good?
Yeah, we're good. And I just want to say thanks a lot for having us there for this conversation, because I think it's so incredibly important to recognize and to have these conversations and to have so many participants here. And thank you all for your time. I'm just now about to doze off.
Yes. You can go to bed. Renza, you can start your day. Grumpy, I don't know what you do at this time of night, but it's the middle of the afternoon here in Rhode Island, so we're going to be signing off. And for the CWD community, we're doing our next chat in 2 weeks, so we hope that you'll be logging on and joining us for the next Screenside Chat with CWD. We're looking forward to sitting with you. Thanks, everyone, for joining. It's the end of a Zoom call, so everyone has to wave. That's how this works.
So much.
Bye, guys. Thanks for being here.
Lovely. Thank you so much.
Bye.